Assalamualaikum and a very good afternoon, everyone. How's everyone doing today? Well, good. It's good to see that it's full house today and smiling, happy faces on an afternoon. And so, thank you again for making the time to be here. And whether you're joining us as practitioners, advocates, policymakers, or just concerned citizens, this conversation is deeply personal. And because aging in the end touches all of us, and as it is a rather sensitive subject matter, I think many of us would love to age gracefully, but how many of us can confront the topic of aging with grace? So that is something that is going to touch us all. And as daughters, sons, caregivers, professionals, and one day, as elders myself, I can't help but imagine how would city look like, all wrinkly and no longer good looking. And Malaysia is set to become an aged nation by 2040, and nearly 1 in 5 Malaysians will be over the age of 65. So aging will hit us all. This is not just a demographic statistic, it is a call for us to reimagine how we care, and not only for our elders, but for each other across generations. We often hear stories such as my mother, for example, used to work and used to be the strongest woman that I know. But when she became bedridden, I realized how fragile our support system really is. And to see one's mother in such a condition is truly heartbreaking. Many had to quit their jobs because there was no care center that is affordable nearby. And for most, it wasn't a choice. It was actually for survival. Stories like these are not unique. It reflects the daily reality of countless Malaysian families, especially from the B40 segment. And for many, caregiving is not a decision. It is an obligation made in the absence of alternatives. And often, it comes at the expense of livelihoods, dreams, and well-being. So why are we here today? At Yayasan Hasanah, we believe that aging should not mean being left behind. We believe that elder care must be part of how we build an inclusive and compassionate society. And that dignity should not be negotiable, no matter one's age or income. This is why we are really proud to support change makers who are turning these beliefs into action. Today, we are honored to have with us, Alhamdulillah, 3 of our social enterprise partners who are really doing extraordinary work in this space. So I'd like you to give them a very warm applause to Dr. Sazlina Kamaruzaman of Jom Makcik, Oretta Herrera of Oretta Senior Care, Izzati Nasir of Teman Malaysia. Through their dedicated efforts, from home-based care to community companionship and caregiver support, they're not only addressing urgent needs, but also creating jobs, building skills, and strengthening community resilience. Although they are young themselves, they're able to empathize the predicament that the elderly go through on a daily basis. Under the Hasanah Social Enterprise Fund, we are proud to help them scale and sustain this impact. We also extend our heartfelt thanks, especially to Dr. Azimah Pilus, whose contributions in the field of aging and healthcare have shaped not only our understanding, but also the practical approaches we take towards elder care in Malaysia. Her commitment to the well-being of older adults and her tireless advocacy for improving the quality of care for our aging population has been a beacon for all of us in this sector. Dr. Azimah's guidance has been instrumental in helping us identify and address the pressing challenges we face in providing dignified and affordable elder care. In particular, we would like to highlight one crucial and often neglected aspect of this care ecosystem, palliative care. Palliative care is not merely about managing end-of-life conditions, but it's also about enhancing quality of life for older persons living with serious chronic or life-limiting illnesses and for their families. It is about providing relief from pain, preserving dignity, and ensuring that individuals can live their final years in comfort with meaning and their own terms. And in Malaysia, many elders do not have access to such care, and there are not very many experts to start with. And Dr. Azimah Pilus is one of those experts that we have in the country, alhamdulillah. Whether due to lack of awareness, insufficient trained professionals, or limited availability in public and rural health systems, the gap is real and is growing. This results in unnecessary suffering, not just for the elderly, but also for the family members who struggle emotionally, physically, and financially to provide care without adequate support. And this is where palliative care becomes a matter of social justice. Access to compassionate, holistic, and culturally appropriate care should not be a privilege reserved for the few. It must be recognized as a public good and a public responsibility. We are incredibly fortunate to have thought leaders like Professor Dr. R. Sean Morrison, Chair of the Brookdale Department of Geriatrics and Palliative Medicine at the Icahn School of Medicine at Mount Sinai, as a friend and supporter of our aspirations. Although he cannot join us today, Dr. Morrison has expressed his sincere commitment to walking this journey with us to strengthen and expand the quality of palliative services in Malaysia. Through his esteemed colleague, Dr. Azima, he has shared knowledge, insight, and global best practices, lessons from models that have transformed care in other parts of the world. And his generosity of spirit has opened the door for future collaboration between Malaysian institutions and Mount Sinai, New York. A partnership that could uplift not just palliative care delivery, but also education, training, and policy reform. This international solidarity reinforces our belief that compassion has no borders and that shared knowledge can accelerate change. And I would like to thank Dr. Azimah Pilus for bringing on board some of these experts from overseas, from beyond borders, to help us in Malaysia learn more about the importance of palliative care. Thank you, Dr. Azimah. At Hasanah, we view palliative care as a fundamental pillar of elder care. We believe it must be integrated into our healthcare system, embedded into community-based models, and included in national planning for aged care. Just as we must train more caregivers and geriatric specialists, we must also empower families with knowledge so they are not alone in navigating the hardest moments of life. Because we care for our elders reflect not only our values, but the kind of society we aspire to build, one that is kind and full of heart. So equitable elder care is not just a program for all of us. It is something very personal. It is a personal mission for me. And palliative care, as part of this mission, represents our deepest commitment to human dignity, one that recognizes that every stage of life has value, and every person deserves to be treated with kindness, compassion, and respect. Thank you for joining us today. Let this be the beginning of a deeper conversation, stronger collaboration, and a more inclusive approach to aging in Malaysia, one that leaves no one behind, not even in their final chapter and their hardest moments. Thank you very much for being here. I wish you a very good session, and God bless us. Thank you.
Today, we are privileged to have a distinguished panel representing viewpoints with varied experiences in their respective fields. We will be spending the next hour in the panel discussion, after which we will have Q&A session. To our virtual audience, feel free to use the Q&A feature to ask any questions that you may have. Without further ado, I would like to welcome our moderator for today, Hanis Anissa binti Abdul Rafa, Senior Manager, Social Enterprise of Yayasan Hasanah. Together with our panelists, again, Dr. Azimah Pilus, Dr. Sazina Kamaral Zaman, CEO and founder of Jomakci, Oreta Herrera, founder of Oreta Senior Care, and Izzati Nasir, co-founder of Tema Malaysia, to continue with the panel discussion. Thank you. Hello.
Assalamualaikum everyone. My name is Hanis. I'm a senior manager from the SE unit in Yayasan Hasanah. Before I start, I want to show of hands. Who knows what is the percentage for a nation to qualify as an aging nation? Show of hands. Or who knows? Who knows the answer? Percentage. So percentage of population of elderlies above 65. That would qualify you as an aging nation. No. No. Come on. There's no gifts. Just bragging rights. No, that's too high. Percentage of population. What qualifies you as an aging nation? No. 7, that's right. Someone Google that too. Okay, so 7%. It's actually 7%. And who knows what's Malaysia punya aging population, percentage-wise? That's right, 7.3. Pandai, siapa tu? Bagus, wow, bagus. Okay, so to put into context, Japan, a famously aging nation, they are at 29%. And as Dr. Azima rightly pointed out, US is about 17%. So, but Malaysia is very concerning because Malaysia is aging faster than expected, according to UN and DOSM. And in 2040, we'll get to 1 in 5. 1 in 5 of us will be aged. Right? And who here lives with an elderly? Show of hands. Oh, quite a number of you. Yeah, so you're the right crowd for today. Okay, so to us at Yayasan Hasanah, aged care is not just a health or a welfare issue. It's a reflection of the kind of future we want to build, right? One that values dignity at every age and where no one is left behind. So whether today you're a policymaker, caregiver, you're an SE, or simply someone concerned about aging with dignity, this session is for you. So even if you don't live with an elderly at home, you will be an elderly one day. So pay attention today, okay? So to welcome the panelists, we've heard from Dr. Azima already. So probably we start with Oretta. How about you give us an introduction about who you are and the SE you're behind?
All right. Hi, good afternoon, everyone. My name is Oretta Herrera. I'm the founder of Oretta Senior Care Services. So what I do is that I run a non-medical service of senior concierge services where we accompany seniors for hospital appointments. And quite recent, I opened up a senior daycare center as well in PJ and Cheras. So the purpose of why I started this is always start off with my own experience. So I used to bring my own dad for his hospital appointments, and also we have grandparents that we care for when we were younger. But it's only in the time when I used to bring my dad for his appointment that I realized there is a gap in our system of seniors coming for hospital appointments. It's like when you're sitting in a government hospital for like 4 or 5 hours, you see them just moving about, not understanding to navigate around the hospital area, not understanding where to get things and everything. I was like, hey, this could be something really interesting that I can start off with services for seniors to bring them, to help them to understand what the doctor's consultation about, and help them to see through the medication, help the children to know what they have gone through after the doctor's consultation. And I had that idea way back in 2010, but I only started my business in 2019. And the services has really opened up my own eyes and perspective about the healthcare system in our country. And I believe there's so much that we can do, and I'm so glad that the services has actually helped many of our clients who are living abroad out of Malaysia. And it has been a very humbling experience for me and my team, actually. Yeah.
Okay, great. Izzati Nasir of Teman Malaysia.
Assalamualaikum and good afternoon, everyone. I'm Izzati, the co-founder and CEO of Teman Malaysia. So how me and my team started this is actually when I enrolled myself into a social enterprise incubator program called Seed Lab. It is a program by Petronas and Tata Consultancy Services. So the program started in January 2020. So we were supposed to be in the program for 1 year, but well into 3 months into the program, lockdown happens. So we were given the scope of social and care. So me and my team were looking at elderlies, women, kids, and even pets at the time. But when lockdown happens, we really see the issue of elderly separation from their family members. The children are cut off; they're not able to meet with their family. So that's where we find the gap within the system. But we are also looking into youth unemployment problem during the SITLAB program. So due to lockdown as well, a lot of people lose their job and are looking ways on how to make money during that time. So it is a very good concept where we connect the elderly problem and also the youth problem who are not getting paid and not getting jobs. They are being let down. So we just coupled the two problems together, and that's how we created Teman. And when we do the service, we just started with companionship because I don't feel like I want to do like the typical caregiver. I remember last time when me and my team started, I'm looking to teman all this uncle to go karaoke, play paintball, things like that, because a lot of elderlies now, they used to study overseas. They used to be very active while they were working and studying abroad. So when they are here, they have to be like the typical retirees. So pergi surau, pergi pasar, pergi tai chi, that's all. So it's very boring, because I don't want to be doing like the typical caregiving, typical maid, and what is missing in the ecosystem. So that's how me and my team started with Teman. But we see that not a lot of people are ready to pay for the fun stuff. They want to pay for the must go lah. I cannot do this, you help me, then I pay. I don't need you to bring my father go kopitiam, I don't want. So that's how we started doing hospital appointments, customized activities, and we also do caregiving at home, where our carers are called Temanians actually. It's Teman and Companion. We made up the word Temanian, but every time we go to our elderly places, they can, you guys are this minion lah. You guys are wearing yellow. Like, no, uncle, we are companion. Yeah, so that's how I started.
Great. Dr. Sazlina of Jom Makcik.
Okay, Assalamualaikum and good afternoon. Thank you very much for inviting me to this sharing. Okay, my name is Sazlina. I'm from UST Kebangsaan Malaysia. Actually, I'm a lecturer for 20 years. So listening to Dr. Azima, I was like, okay, flashback to my student days. And okay, so this is what my students are actually experiencing. Okay, so basically, because my background is actually in rehabilitation. So I work with mostly actually focusing on community-based rehabilitation. I'm not focusing on the patients or the clients who are having this disability, but I'm more focusing on caregivers. So we train actually caregivers on actually how to care for their family members. So in my experience, I've also been seconded by the Prime Minister's office, where we actually built the first early intervention for autism. Okay, so that is where I experienced a lot of things actually from the parents, where when we told the parents, you need to bring your children to the center to receive therapy or to receive training and so on. But the problem that the parents always say is too far away, I have no time, and that actually impaired the service as well. We see that some of these clients of us are not able to progress because of commitment. The caregivers are not committed enough to bring their children or to bring their family members. So that's when we started a service called Makcik Travels, actually. Initially it's called. Why makcik travels? Because my family, they refer me as makcik and I love to travel. So I said you should name it as makcik travel. So that's how we started. But the problem is that people always say, where do you go to? What tour? They thought we are like tour company or something. So that's when we, after COVID, we decided to rebrand to Jom Makcik. So our main goal is actually to bring clients or people with disability to improve their access to healthcare. So we started off with transportation. So we actually engaged with ladies. We started off in Bangi with 20 drivers. And when the word gets around, we get phone calls, mostly from makcik lah. Makcik was saying like, oh, thank you so much. I don't know who to contact. I don't know how to use Grab. My children are far away. I don't want to bother my kids. So we have all this makcik that actually get our service to go to the hospitals and clinics and so on. So that's how we started.
Jom makcik, macam tu lah.
Yeah, Jom Makcik. So we were trying to get people out of their house to be more active and so on. So that's the main goal of Jom Makcik.
That's great. So all our SE partners here, they are, experts in their own rights. They are recipients of actually Hasanah Social Enterprise Fund that the SE unit does, right? Oretha from 2023 and Dr. Saz and Izzati from 2024. Okay, so they have a lot of commonalities in their services, but they come with different and diverse experiences to offer us today. Okay, so jumping into the first panel discussion, it's about understanding the aging economy, and our objective will be to understand the macro level challenges facing Malaysia's eldercare system. So to ask, the most senior in the panel today, Dr. Azima, as Malaysia moves towards becoming an aging society, what do you think are some of the biggest shifts in health, social, or even economic that we need to start preparing for?
Actually, there are many gaps. For instance, these are the social determinants of health that I mentioned earlier. Yep. And okay, this is, for me, in palliative care, this is the biggest gap. We have 2.5 million people aged 65. They all have high blood pressure, diabetes, and so many others. If they're sick, they might go to the GP clinic. They're no longer covered by their insurance. So I don't know, it's probably self-pay or their own. And if they're very, very sick, they go to the hospital. And if they have stroke, they might get admitted to the palliative care unit, and then they go home. Some others from the GP clinic go straight home, and the others who didn't even go to the clinic go straight home. So out of the 200,000 people who have been certified to need palliative care, we've been able to provide only 20,000 services to 20,000 of them. So to me, that's the biggest gap. And that's why my interest to come back to Malaysia, because I spoke with the Minister of Health. They said they're building more hospitals, but each hospital has only like 12 beds. So they're building 8 units. So it's 96 beds. So it's like, you're going to see 96 patients or what? But there are 200,000 out there. So why don't we go train the community workers in the homes? Yep. So you can train a lot more. And most patients, maybe 95% of them have homes. So you don't need to build a hospital. We go to their home. That's what happened, because I can say that because it happens in New York. We train the caregivers because Medicare pay for them to be trained, and they have an income as caregivers. Yeah. Because that's something that we need to look at. So that's one of the gaps.
Yeah, great. If we go to the slide before.
Which one?
Just to, for the benefit of the public and the people here today, social determinants of health. I think this is the first time people in Malaysia are exposed to this sort of framework. Would you mind explaining to us, what does the SDOH actually means?
Okay, social determinants of health came up because each state or each county have put some of the basics for the care of the elderly. But then they see the difference in the results. For instance, if they say reduce avoidable hospital admissions by 25%, some communities couldn't do it. Yeah. So they figure out what were the reasons. So the social determinants could be there are no transportation for patients get care in order for them to get stable, or what we call food desert, in the sense that there's no healthy food in that neighborhood. You have to remember, in the States, McDonald's is very cheap, $5.
Yeah.
But the other food is $15. So the poor people eat McDonald's all the time. But in Malaysia, they're quite expensive, which I'm happy because a lot of people cannot afford it. I went to KFC, I said, wow, 30-something ringgit. Like, who can eat this? Like, because you can buy or laksa for 8 ringgit or something, which is good, actually, which is good. So these social determinants of health, there are 12 items that they have listed that have impact on the health status of the individual. So that's something that we need to do to close the disparity or inequity in terms of healthcare. So this is, well, if you are a sort of very hip, you should start using the word social determinants of health.
Everyone. Yeah, so I think in essence, as Malaysia shifts towards becoming more of an aging nation, it forces us to look into these 5 key levers, right? Into the shifts, we're going to have to look at education, healthcare and quality, neighborhood has to be improved, and social and community, people have to be more involved in looking after your elderlies, and of course, economic stability, right? Super important. Right, and you touched about gaps. Dr. Sazlina, from your perspectives, what are the most urgent care gaps, particularly around, affordability, caregiver capacity, and actually support for aging in place?
Okay, talking about gaps, yeah. Actually, in terms of healthcare itself, I think we have moved very fast, very forward. We have good healthcare and so on. And looking into the transportation as well, we have wonderful, road system. We have MRT and so on. We have Grab that actually, where people can always access, facilities and so on. However, we forget about the elderly who are actually not moving with that technology. One of the main issue that most of the makcik who call us is that I don't know how to use smartphone. Yeah. Even they actually call us when we said, WhatsApp us so that we ask them to send location. They're not able to do that. So there is a big gap in that in terms of knowledge, age-wise. So that is actually one thing that we need to think about, because if you look at Japan, for example, they still maintain the traditional way of, in terms of management, like for example, purchasing items in the shop, they still use cash. Yeah. We are now moving towards cashless, and you know that the elders, some of them are not. They don't actually know how to use all this QR code and so on. Yeah. So that is something that I think we need to do something about that. Yeah. Why are we forcing the elders to use smartphone when they find it very difficult to do so? So, like Jo Makcik, we've been wanting to have an app, because everyone was saying, like, you should have an app so that everybody can access your service. But we still insist on having an admin to actually receive calls, because we do, once in a while we get people with disabilities, we have elderly who don't know how to use WhatsApp, so they call us. Yeah, but of course there are disadvantages of doing that. But this is something that I believe we need to look into, right?
Okay, so mostly technological gaps lah. Because otherwise, how would they know to use all these new facilities, right? The innovative models behind what we are offering them. Do you have anything to add, Izzati? Okay. So I want to touch now on the social or emotional needs of the seniors that you have met, right? That need your services. Maybe you can share a bit, a bit about that with your work at Teman. Yeah.
Okay, so I remember when we first started, I was one of the Temanians doing the services myself. So I met with this uh, grandma in Subang. She's 88 years old, if I'm not mistaken. She's living here alone in a two-story house in Subang where all her children are living overseas. So every part of her house is filled with CCTV because all her children and grandchildren want to monitor her. And then when it was actually the granddaughter that actually contacted me asking for a service. So I was asking her, is she able to eat on her own? Is she able to walk? Yeah, she can do everything herself. So I was kind of confused. So what do you need me for? I just talked to her lah. Just for that, simply just for talking with her. You know, I'm sure all of you have had this experience before where you were talking with someone older, they keep repeating the same stuff again. I see a lot of nods already. So they were talking about the same thing. So in a way, having a Temanian over in their house is just to fill that void where they just want to talk to somebody. And plus you're getting paid to listen to the same story lah. And no hurt in that, right? And sometimes what's interesting is the story can change over time. So they get creative with their stories. So it's good for them, you know, because it needs mental power to actually create new stories over time. And I remember another service where uh, it is in Subang, the service for the grandma, and it's very mostly the Chinese are staying there, you know. So after when it's like 5:30, I would take her out just to walk around the field, the playground, and then all the aunties were asking, "Who's that? Who's that?" They were asking in Mandarin. I don't understand, so I asked her, "What are they asking you?" They asked her, "Who you?" You Malay ma, you know my cucu ma, something like that lah. So, and suddenly a lot of people keep on asking her, oh, where can I get that kind of girl to come to my house? So it is very a common problem. And there's another case where this Temanian, a male Temanian, were matched with an elderly man. Just similar service with me, just to have a walk for like 30-40 minutes in the afternoon, 2 or 3 times a week. So we feel that the elderly would benefit most from the service. But in actuality, the Temanin is actually a journalist, and that uncle used to work with Tunku Abdul Rahman. So every time, the Temanin is the one that is looking forward for the service because he feels like, oh my God, I got so many history learning to do, and I got a lot of things to put in my next article and things like that, you know. So when we feel like we're doing a service for the elderly, but in reality, the youngsters, the one who is getting paid for the service, not only getting money, but they're also learning what other things, you know. And another emotional things that might be lost with the elderly is that they somehow lost purpose when they were retired. Like my own father, he used to hold a very high position in the government sector before he retired. So he did not really prepare for his retirement. So when retirement hits him, he didn't know what to do. He is not prepared for it. All his friends were friends from the office. They are not living near his place. So his only go-to is the surau, the local surau. But then COVID happens. So he did not know what to do, and he's kind of lost. So when we do have someone over, maybe he can still talk about what he used to do before and things like that. It's just something that he needs to continuously doing so that he won't fall further into loneliness or losing, okay, what's the point of living if I'm not doing anything more beneficial, right?
There is a stat that actually almost half of Malaysians aged 60 plus report feeling lonely or socially isolated at least once a week. So actually these services actually the providing of accompaniment service phone, I think, helps them a lot mentally and emotionally, right? Yeah. So so on to the next question, right? Oretta, I want to touch on the mental health aspect now of caring for elderlies. Some of the questions I think the attendees asked was, how does actually one cope with being a caregiver? Because caregiver burnout is a big challenge that you guys are solving for,
Yeah,
right?
exactly. I think it's emotionally, it's mentally, it's physically very challenging. I myself was a caregiver. Me and my siblings were caregiver to my own dad when he was battling cancer, and it's not easy. You know, you're in KL, parents is in Seremban, and then you know he calls one time, and then you have to rush down. You know, it's a very typical thing that you have to do, and it's like your duty, lah. You know, but for caregivers, I think it's just like not only just family members, right? I think when especially I in my industry right now, I notice like family with big children. I mean, big family with many children and all that. They also have this problem. Out of 5 kids, only 2 is doing it. The other 3 is not in and out lah. It's the reality of it. You know, I think we have seen it in even like in the hospital or companionship, right? You can see that the family members, they only want to get involved when they need to get involved. And I hear a lot from my clients as well, and they talk about how it mentally very tiring for them, emotionally, until to the fact that it affects the relationship with the senior, with the parent they are caring for as well. I think, in my opinion, I think it's very important that as a caregiver, you need to put certain criteria and certain boundaries as well. Firstly, you need to educate yourself about that situation that your senior is going through, whether it's cancer or whether it's a stroke and all that. So every sickness is different from one parent to the other. And people always have this understanding like, oh, if I can do it for my mom, I can do it for my dad. But don't forget, it's like both of them had different sicknesses and disease that you have to understand, and you have to read about it, you have to learn about it, the type of medication, when to do this and everything, right? So number one, I believe that you really have to educate yourself. If you're not sure, get in touch with your doctor to ask more. The experience of people in going to government hospital, they always think that the doctor's got no time for you. But the thing is that if you don't ask for that help, they won't have that time to talk to you. And trust me, just like Izzati, I did the hospital runs before when I first started 6 years ago. For a year and a half, I was the one doing it. And I even tell the doctor, like, can you explain more? How can my client, or even for myself, to care for my clients or care for my parents, what can we do more and understand the situation of that sickness? And they are willing to teach you in very fast tone, but you just need to just catch it up, and then talk and discuss with the family member. I think that's very important. And you need to set also realistic expectation. Don't think that you are a superhero and that you can do every single thing. Yes, family is sometimes it's not easy to deal with. You have siblings. It's like, oh, I'm the one in KL, but my other siblings are out of the state and everything. So you have to discuss with your family and set that type of realistic expectation. Don't do more what you can't, and then that's where burnout comes in, frustration, anger, everything will come in all together, and then you have this big blow up in the family as well. Okay. Importantly, I think just like in our daily life, set a routine, especially when the person needs more care. In the morning, yes, we have to sacrifice our time getting out a little bit early to give them their medication, mandi them ke, whatever, right? And do that routine. It's very challenging right now because like we are all in this sandwich generation, right? You have to care for your own family and you have to care for your seniors as well. And sometimes you ask yourself, oh my goodness, it's like, when is this going to end? If you set proper routines, do it right, get some help, support, it can be better. You just need to let go a little bit and just manage the expectation, basically, and don't be afraid to ask for help. Currently, I mean, there's so many of services that's provided in Klang Valley. One of us is like the services that we have. Yeah, and you can also like ask friends and for caregivers, especially for those who need respite care. That's very important. Giving time for yourself as well, which is the utmost important thing. A lot of my clients will always say like, I'm so tired, I'm done with this. And I said, no, but you can't give up in the end of the day. So the daycare that we run, I have a lot of the wives who send their husbands because maybe most of them are not well. They are also post-stroke patients. They need that time for socializing, motor skills and everything. So the wives come and send their husband for respite care for themselves. So the husbands come in like twice a week. So the wives get to spend some time caring for themselves. I think that's very important. I noticed that primary caregivers like spouses, right? It's always the biggest thing. And they feel that they need to be there and do this, clean this, do this. And I say, hello, you can't be cleaning the house, taking care of your husband who has mild dementia and has Parkinson's and all that. Hey, I give you contact. Please go and call somebody to clean your house. Or get someone to cater for you. Right? As simple as that. But then again, it's a lot of the change of the mindset. I think it's educating them, and I think it's also about supporting each other. And talking about support, right? I mean, I've been unconsciously, I have my own small support group for my clients. So whenever they need some sort of they need to talk, they will call me up, and I just listen to them and just guide them. It may not work 100%, but I think that's very important. That the main thing about caregivers is to find your support group.
Yeah,
Very
so
important.
it's great. So some really good tips today, right, for people who are caregivers. One last little question for Dr. Azima before we close this part of the panel discussion. Dr. Azima, so according to the Ministry of Health study, Malaysia has fewer than one geriatrician per 100,000 population, which is well below the WHO's recommended ratio. So in your opinion, would you think the current government or community initiatives is sufficient to meet the growing demand?
Actually, this is not my opinion. It's someone who is an expert under quote Blue Gallon Center wrote this. He says that based on this formula that 70% of all geriatricians train at least one geriatrician every 3 years, then you'll reach the goal for UK or for Canada. I don't really understand the math, so I don't really want to comment. But the important thing is, it's not just the geriatricians. You have to train nurses. We have to train nurses aid. We have to train caregivers in the homes. So it has to go in tandem. Of course, you need the doctors there. Yeah. But I think the error is for us to focus too much on hospital-based care and not enough on community-based services that we can provide to keep the patient happy at home. So we will have some more geriatricians, and you don't really need a full-fledged geriatrician, because in my experience in New York, you can do a fellowship at 1/3 the length of time and still know how to manage patients, because as geriatrician, you work with the primary care doctor who's taking care of the basic stuff. You just do the additional piece. So I think we're there, so don't give up. You all are still young. By the time you reach my age, you have enough geriatricians.
Let's hope for all of us. So it's more of a systemic enhancement, is what you're saying. It's more than just the geriatrician's job to make everybody better. Yeah. So okay. So jumping in now to the second part of our panel discussion, we want to dive deeper into our SEs, highlighting the existing eldercare solutions that they are offering. We've covered a lot of ground already, but probably Dr. Sazlina, I wanted to ask you first, how does your service actually positively affect women caregivers specifically, right? Because we were talking about how women may live longer, but we also do everything. We work, we go home, we take care of everyone, we cook, we clean, everything. So how does your service actually, there's a use case to positively affect the women caregivers?
Okay, thank you for the question. Okay, so Jo Makcik, all our gig workers, we call them Adinita. Adinita comes from the word Adiwira Wanita. So they are the ones that actually help our clients when they are in need. So, and most of our Adinita actually is either they had to stop their job because they need to care for their own family. we have a few of our ladies who they are actually accountants. She is actually an accountant, but she had to quit her job because she had to care for her husband who has stroke. And then we have also ladies who are caring for their mothers who have stroke at home. So one of the things that, because they are actually full-time workers before, and when they had to stop their job, they find it very difficult because firstly, they loss of income, and also loss of friends who can actually support them, mentally and socially and so on. So when we have this, when we recruit them, normally we will meet them and we ask them why do you want to join Jok Majid? Firstly, it's because of the income generation. They feel that this is something that, I want to generate income and I want to at least have something for myself. Secondly is the social part. This is something that I noticed recently because we have a few sessions with the ladies, we have training and so on. And one of the things that I noticed is that they find it, when they start meeting other Adinita, this is the time when they share their experiences, not only helping their family members, but also helping clients. And I find this quite refreshing because, when during training, we actually train them on how to transfer patients and so on. When we ask them, are you able to do it with the client? They will say, no. Then I said, oh, so why are you here? Well, it's actually because I want to meet other Adinita. This is a support, it's a support group. I find that this is something that I really, after for so many years, I realized, oh, this is what is missing actually in my company. So this year we're hoping, and thankfully with the support from Hasanah, we are going to create more courses, but at the same time, it's actually more of a social event for our Adinita. Because I know one time we had this course called Autism Travel Care, because we have requests from parents to bring kids with autism to school and so on. And during that class, after I've already trained them, I asked them, are you brave enough to bring a kid with autism? They said no. But I think during that session, when they hear other Anita, it's not a big deal, it's simple and so on. And after I met her the next session, she said, finally, I'm able to do it. Because this is the support system that actually we're talking about. And I think Jok Majid is looking to do more training for the ladies, not just to improve their knowledge, but also to have this session where they can meet others. Somebody who is committed enough to provide care for the community, at the same time, knowing that they're not alone in this venture. Yeah.
Izzati, do you want to share?
So I really like the concept that is happening in the US, where the primary caregiver, the family members are getting trained and also getting income while caring for their own family members. Because a lot of GDP is lost because all these women have to quit their jobs because they have to care for somebody at home, be it their parents or their children. So if they were getting paid as a caregiver, as a primary caregiver, that would definitely solve a lot of problem, because a happy mom, a happy house, right? Because they don't have to worry about the money, but at the same time they're caring for the person that they love at home, without having to worry what are we going to eat next day and things and so on, right? And another thing that I see the gap within our system is that people are not looking at caregivers as a professional worker. People keep saying that, the level might be the same as a domestic helper even. Yeah. So we want our caregivers to be professional. It is a work that people would opt for. Like, why I'm doing this on a daily? Why not? I'm certified to do this. So Teman is actually working with our counterpart in Setera and also Kendana, where we were looking at to certify or like maybe have a board of association where all these informal caregivers are recognized, are accredited, and also giving credentials like, okay, I'm not just random people doing caregiving, I'm actually a professional caregiver. So when they are given recognition, when they are given the platform to really do this as a professional work, I do feel a lot more women are even willing to do this because they already have that skills by doing something that is natural to them. They just need someone to actually recognize them for it.
That's great. And Noretta?
I'd just like to share as well, like my colleagues here who provide the job opportunities. For me, I bridge the gap by giving the senior citizens job opportunities. So my team for the hospital companionship, the range between 50 to mid-60s. Some of them retire very early, and they still have the type of skills and the ability to drive and help their own community. So, I mean, because I had the experience like most of my friends as well, we had to quit our job because of taking care of kids and everything. And, you know, I tried looking for a part-time job with pays, real peanuts sometimes, right? You know, and it's like, where's this dignity of all this, right? And you want to bring back into the family, you know, help the economy of the family and everything. And I promised myself that if I were to run something like this, I will look into something more dignified. I think it's more about dignifying themselves into living a better life, even though they are retired. And I'm very thankful for my team of concierges, I call them, right? It's like they go beyond than what they can give. They are like practically like caregivers, like you say, but they're not certified. It's just that their time and the effort that they do for their senior goes way beyond my expectation, even to my clients as well, which is fantastic. You know, it's not about the money being paid for the service, but it's also giving the team being dignified to be able to purposely be very purposeful for the whole community, basically, right? And I really enjoy how they are enjoying the time they're doing this and everything. And for them to understand more about aging, when you're in the job, you will see yourself, right, in the next few years how you're going to age, and you learn from that. And through with that as well, right, they will talk to the seniors, and then the seniors were like, oh, okay, and they share their experiences, right, and that's how it's a community thing in the end of the day, right? You know, I think it's very important that our caregivers, whether it is family members or the people who are being paid to the services, right, it's to be, the government can give the type of support in supporting them to become certified professional caregivers so that they can help more, not just beyond their family, but just to their community around them. Yeah.
Okay, that's great. So we touched a bit on, giving giving dignity back to the caregivers, right? I also now want to touch about the unemployment issue that you mentioned just now. How do you actually build trust with the elderly and their families, and especially in the undeserved communities like B40, and solve the unemployment issue?
What we learn with working with the B40 communities, a lot of them we don't want to come out and be the only one saying that, oh, I need this service. They would really be come as a collective group of people. If we were to go on the ground, if we were to do community outreach, that would be better to understand because they don't want to be the first one to complain about their situation. But if they were to come in a group, then it would be better for them. So we would love to organize a session with them, like sit with around like 4 to 5 makcik just to listen to what problems do they have, right? So that's usually the way to go to understand these people. And also, I think um, sometimes we as a community should really stop feeling guilty or see if we saw one elderly walking alone, right? What would most of us think? Kesiannya dia, kenapa dia jalan sorang-sorang? It's usually what we feel, right? But actually by allowing all these elderly people still doing things on their own is actually empowering them. You know, we need them to stay active. We need them to still go to the groceries and pick all the onions by themselves. They still need all that stimulation from the community, you know. So that's why sometimes we have requests from our customers. Can you go buy some, pick some stuff from my parents? Can we just pick up the prescription from my mom and go pick the medicine from our clinic, something like that. I said, can we bring your parents along? Are we allowed to do that? Because sometimes, you know, all these pakcik-makcik, they are looking forward to go, even just a simple hospital appointment, you know. That's when they are able to talk with somebody. It is common. You are sitting alone in the hospital cafe, and then one pakcik or makcik will tegur you, right? Makan tu je ke? So they need all that the interaction. And we should stop feeling sorry for elderly who are still want to be active. So within the B40 community, we can still see that, but to understand them better, we should really let them go out there and mingle around. Then we can know what they need.
Okay, thanks for that. I think I want to ask now a very SE related question. Dr. Saz, what challenges have actually you faced in scaling your model? So, for example, in funding, in talent outreach. So, in the waiting room, you're like, how's business? How's business? So, this is like very business and enterprising. Okay, so I want to know more about what are the challenges? You know, what are the to appreciate your journey a bit more.
Okay, thanks for the question. Actually, in Malaysia, we are still the public has still lack knowledge about what SE is about. They always think SE is something that is similar to non-profit or NGO. Let me just share. We actually do business to business as well. We provide service for companies and so on. So we have a special car, we call it a car, where we have RAM and for wheelchair users, right? So this company said to us, we need your service, but we may have problem paying for the service. So I was trying to explain to them, well, actually we are a business. We need, the only way for us to provide the service is by getting paid, you know. So they will say like, oh, kesian lah ni orang wheelchair, tak kesian ke? Macam tu. So I was saying like, yeah, that's why we have the service in the first place, to help the people with disabilities and so on. But this is the thing that our company actually counter, when people think that, when you're dealing with, the charges should be lower and so on. So this is the thing that we need to sustain the business, and also to maintain the service that we provide for. So in terms of scalable, right? We have 600 admita. We have 600 admita, but the only ones active are about like 100 or so. And one of the reasons is because when they're dealing with people with special needs, right? When we train them, they need to be like one-to-one training. So some of the training we actually conducted in Kuala Lumpur. So we have people like in Taipei, in Penang, you were saying like, unique training as well. So this is something that we need to think about. Right now, because before COVID, we have like in 8 states, so we had to stop due to COVID. So right now with Yayasan Hasanah, thankfully, we're going to start first expanding our service to Negeri Sembilan. So we start with a coordinator. What we did before is we have a coordinator for that particular place, because this coordinator know the needs of the people at their place. So this coordinator will train this coordinator on how to actually do recruitment, how to do marketing, and then once they recruit Admita, we start training the Admita. So this is the scaling that we're doing right now. But
maintain that service to the to the level that you think is best. That is very difficult, especially when it is far away from you, right? So this is the issue that we have when we talk about like providing the same service, professional service that we have here in Kuala Lumpur, but we want to replicate it in Johor. So it's very difficult because it's far away, and we need to have a person who is actually dedicated, understand the social issues in that particular community. So I think that is basically what we are struggling with right now, because to find that dedicated person is not easy. Not everybody is actually enough to work with the community. Yeah.
Okay, so in short, a lack of awareness is causing a bit of a price sensitivity issue amongst the customers and also tenant, right? Okay, so maybe Izzati, you want to chip in as well on scalability of your SE?
Yeah, it is a constant struggle for us social entrepreneurs to provide the most affordable service, the best quality service, and the highest pay to our Adinitas, miners, and concierge. But at the same time, surviving and paying ourselves at the same time, right? So we were here to help, but in order for us to always be here to help others, we need to survive ourselves. And also to provide a somehow standardized service by providing manpower is not easy. It's not for example, today I'm sending A to the house and tomorrow A is not able to come, B is coming. A and B is not the same person. Regardless of how many trainings you provide, it's not going to be the same person. If the uncle wants A, he wants A. No matter how good B is, he wants A. So that's the problem. And also scalability, like Grab, right? They are able to provide different tiers of payments to their Grab drivers, to their customers, because they are that big. They're not even profitable up until this moment when we have drivers all around when we open the apps, right? So to be able to offer the same services and also surviving at the same time, that would be the man's challenge. We would love to provide, because every time I was telling people about teman services, people would say, oh tapi macam tu pun ada servis macam tu. Bagusnya, dekat Kota Baru ada tak? I would love to be everywhere, but to find the quality caregiver, those who are willing to do this with the amount of pay that we are able to give now is quite challenging. But thank you, Hasanah, because we were able to provide trainings to really offer them jobs that, hey, try this out. Maybe this works for you, maybe not. But yes, and Hasanah provides the platform to really try out what works and what don't.
So thanks for that. I think the only element missing today, I was telling them as well, is a person outside of Klang Valley to offer, a non-Klang Valley perspective, right? It would have been more interesting to have that nuanced discussion around the demographic difference, right? Cultural differences in Kelantan, Terengganu, and how they manage their elderly, right? So we're a bit short on time, so I'm going to jump into the third part of our panel discussion, inspiring community action, because we want to encourage community-driven care and informal participation in elder care. So Oretta, can you share some examples where peer support or volunteers actually have made a real difference?
Okay, so besides the concierge services, I recently opened up a daycare service. So the daycare service is a good platform for us to bring our seniors together in their own community, helps them to build up social skills, new friends, and learning, and also guiding them to be empathetic to other seniors as well. As you know, seniors, as they grow older, they lose a certain filter, they lose a certain sense of, they just whatever comes up from their mouth just comes out, right? So there's a bit of a struggle when it comes to in the daycare. But when you spend that time to explain to them why so and so is acting like this, right? You will see changes within the next few weeks or months, depending how they are, basically, right? And they learn how to be more careful, and we have seen how they hey, be careful when you walk, you don't need help not to the toilet. I said, never mind, you don't need to help them because you need that help as well. But the heart is there and all that, right? So with the daycare, it was easy for us to start a volunteer program and intergenerational volunteering as well. So of course, it has to start with my own family as well. So I brought my own children into the daycare, my friends' children as well, like from teenagers to adolescents and all that, right? They came in, so the whole idea was for them to understand about senior citizens, right? Some of them may have grandparents, some of them may be living with one as well, so they understand the whole how it is. And maybe the seniors as well, they may have not don't have their grandchildren nearby them as well. So it's when you see them communicate, right, and how they go through the activities with the senior, it makes a lot of difference because then they start, wow, a lot of things just open up for the seniors because they talk a lot. They want to communicate, they want to share. But during my time, so you always have to look up for volunteers to have that patient. You know, when you start that during my time story, right? Wow, you really need to really listen. And it's no, there's a lot of things that you will actually learn from that. Yeah. Right. And then when they go back to their own family, right? And when they share their experience, it makes a lot of difference because they learn how to be empathetic because I think a lot of people, I mean the younger generation, they don't know how to feel empathy towards people around them. And parents are very busy and I don't blame them. And also with having this type of program, it helps them to be more sensitive and able to want to learn more about caregiving for their own senior, especially younger generation. So I think the volunteer programs in our country, right? There's a very low rate of volunteers in Malaysia, right? I think everybody's like, oh, it's volunteering. I'm not paid for it, you know. I don't feel for this thing and all that. And yeah, I mean, it's everybody's choice. We don't blame them, right? But the thing is that as a business owner running a senior care business, right? If you don't educate the people that's around you, they don't understand the concept of it. So it's helping the community to understand why is it important to be a volunteer in places like this. Okay, like if you go to any aged care home, every company want to do CSR program for orphanage or but what is your take out of it? It's that one time thing, right? You don't have that feel. It's just your obligation to do that, right? So if you come in once a month or twice a month, um, then you understand that I think I can learn more from this, you know. And you as the person who initiate that volunteer program, you must educate and share with them why is it important, how you can make a difference to these people in this way. So it's just from Monday to Friday, right? And you just come here and tell me what days. Even you're coming here to makan a belanja you lunch, is okay. You just sit down, chit chat with them, and that's all what they want. It's just someone to talk. Yeah, someone to listen to them and just hear them out, you know.
Yeah, so that's interesting insight because actually in Malaysia, over 90% of elder care is provided by untrained and informal caregivers. So just one last little question before we jump into the Q&A. I wanted to ask Izzati, a lot of the attendees today, I think they themselves are maybe caregivers. They have elderlies at home, so they want to know what are the channels and resources that they can actually refer to when starting to take care of an elderly.
All right. So, ChatGPT stuff. No. And in all seriousness, like Dr. Azimah mentioned before, all the elderly in Malaysia have that tiga serangkai penyakit that you go to the clinic kesihatan, go there with your parents, with your grandparents, talk to the doctors. They are more than happy to channel you somewhere. We can go to JKM. If sometimes you don't only have to go to them when you need help. They are always there they have counters, right? We can ask them because they are not able to do everything. They're not able to provide everything, so they are very good at teaching you somewhere else. They know where to bring you because JKM is like so burnt out already with everything, with the woman, children, elderly, everything is there. So they will know where to bring you and let you get help because the ministry, the government is doing so much for us already, and we just need to find the resources on where to get it. So you can go to KKM, you can go to JKM, you can go to the Zakat. Not Zakat is not only for it's not only for Muslims. Non-Muslims can also go there. They can also help you to know where the cheapest dialysis center, things like that. A lot of people are more than happy to help actually.
Okay, so that wraps up our final panel discussion. We're opening up for Q&A now. So
If I may add, so that I don't lose this opportunity, actually I brought to Malaysia this training. If you're interested, I can share with you. Maybe I can show you, so that this is one way for you to get certified by Mount Sinai. But there are two steps. One, you have to do the core training online with Mount Sinai, which they give you a certificate, but then it has to be followed by clinical given by nurses so that you're certified. Okay, just let's see. So this is about the Center to Advance Palliative Care, CAPC. So they train people from doctors, nurses, social workers, psychologists, all the way to nurses aid and management staff who manage palliative care services and family members. Can I the next slide, please? Okay, if I complete one module and I pass the post test, it has to be 80%. Until you get 80%, you don't get that. For a person who with no medical background, I will get this certificate. I did it for direct care workers. So this is like your family member. Okay, you get this certificate from Center to Advance Palliative Care. But if you're a professional, can I have the next slide, please? Okay, as a professional, I did that. I get this certificate with continuing medical education from Mount Sinai School of Medicine. They said the ICANN School of Medicine is accredited by the Accreditation Council for continuing medical education to provide continuing. So this gives me credits. So that's the credit, and I accumulated in order to renew my license. So this is for nurses, anyone with professional. Maybe for doctors, it is 0.75. For nurses, they might get 1 point. So this is something that I would like to share later through Yayasan Hasanah as part of their community development kind of program to have Malaysians get certified for care of their family members or have a job. And I told the minister, this is a 3,500 ringgit job, not a $1,000 job. Nobody wants to do it. So hopefully they have the budget for it. Okay?
thank you, Dr. Azima. Are we open now for questions from the floor?
Hi, my name is Leon. I have a question for the organized this event, and then have a secondary question for the members of the panel. My question to the organizers is that in filling up this my registration to attend this event, I had highlighted something I noticed which would be interesting that although the topic title is caring for elders, a shared responsibility, the panel is noticeably of one single gender. So it's the responsibility of caring for older persons, not for all persons who are fit and able, which would include men, not only women. So I wonder, when I made that problem statement, I also offered suggestions for male persons who I know work in the area of public policy of caring for older persons and public policy makers, lawmakers who have some experience or have voiced out on this issue of caring for older persons. I want to know what became of my suggestion. I don't mean you have to accept it, but I wonder, is it discussed to generate this discussion? Was any attempt made to consider these persons, or did you think other persons were more able, or maybe you tried to contact them and weren't available, or what became? Or did you think, oh, this is not a relevant topic, it doesn't apply to us? I'm interested to know what
I think the team is aware of all the suggestions being made by our attendees. But I think at the moment in time, we had already chosen a panel. So probably thank you so much for your suggestion. So probably we take that suggestion for probably next time into the next theme. Yeah.
Okay. And then corollary to that is a question then to the panel. In the absence of male panel speakers, could you possibly represent male voices by referring to your experiences in dealing with male caregivers? I wonder if there are any that have contacted you. What is the proportion of them that have engaged services, and what is their experience? Might it differ from that of female caregivers? How has the work of caregiving for their older persons affected them? Is it the same, different as women? Do they do as much as the women and their family do share? Well, thank you.
Yeah, thanks for your question, right? I think the male caregivers or female caregivers, they pretty much go through the same process of dealing with taking care of a senior citizen or even though if it's not a senior. Of course, when you talk about male caregivers, right, they are always related to a male patient where they have more strength for lifting, for caring for them, and maybe the seniors are the ones who prefer a male caregiver and everything. But I think they go through the same experience as a female caregiver as well. But emotionally wise, it all depends on the individual with the relationship with the patient themselves. How do they manage it, and how do they have this type of communication with their own patient? Some of them are very invested into it. I've not worked personally with many male caregivers, to be honest. Most of the ones that I've seen and have seen in my clients' place are mostly female for many reasons, because it's mostly dealing with the female part of the family members. So I believe the male, from my observation, how they do it is very different from the women as well. Because when you deal with a male patient, their emotions are very different. Their needs are very different compared to the female patients as well. So how they are engaged with them, some of them is just like, okay, you need help in this, I'll do this and all that, I'll do my job and all this, but then that's it. So there's a lot of differences of how they would actually work together with our male caregivers.
So I just wanted to jump in, because maybe I was not clear enough. When I said caregiver, I did not mean employed like a member of your staff that is dispatched to be the caregiver to a client. I meant family members, a personal person to relative to the older person who has taken responsibility as primary caregiver.
The children are the sons, basically, or nephews, or sometimes like that, right?
Example,
Yeah, okay.
Yes, not a hired person
Yeah, yeah,
dispatched to service for example.
From my experience, especially more on the concierge part, right, there are some sons or nephews who take the roles of being the main caregiver. And I've seen, again, for them, because it's the relationship with the parent in the end of the day as well. My experience, I have like 3 clients who are male and working with family, parent, mother and father staying with them. But they will take their time out to make sure that they follow their parent for the hospital appointment. They only take our services because for the mom's dialysis, for example. And normally dialysis is mostly transportation where you just pick and drop. But the son's like, don't mind, I want to pay you to sit with my mom for 6 hours to make sure that she's okay. So this son that I experienced, right, he ran all out for the mom. Very, very caring, and really wanted to make sure that to the end of that she passed on, that he took care of her. So they said in the end of the day, like the children, right, how's the relationship with the parent in the end of the day? And it can be different for every family. The dynamics of it is very different. But I believe that every son or nephew who's engaged with their own parent, right, who are caregivers to them, some of them are very involved, very immersed into caring for their family, and they really go out to make sure that they are taken care of properly.
So like I say, it's all in the end of the day is how is the emotion attachment with the family as well. Yeah.
So I just want to maybe emphasize, it happens that our panel is made of very powerhouse women, but the idea is actually not to reinforce that women are expected to be in that role, right? As for our title is a shared responsibility. So it just so happens, our SE partners are made of women-owned SEs. Okay, so I think we've got also an interesting licensing question. The question is on JKM. So it's from an owner of a cat home as well. Let me just pull it up. Can share on any regulation in setting up daycare services. Is it the same as elderly care center, which will be under JKM?
It's the same as a license if you open up an aged care home. JKM, then the council, BOMBA, KKM, the same process.
Great. There is a question for Dr. Azima. Someone asked, can address a bit on the LA daughters LA daughters problem. The LA daughters means that when you live in LA, right? There's a trend that all you need to do is go and demand your parents to go out and do their hospital appointments.
I'm from New York, so I don't know what the LA people do.
Refers to the child that comes back suddenly
Okay.
from LA to their hometown to take care of the loved one after being gone for so long.
Ah, there you go.
Okay, yeah. We New Yorkers don't do that.
I'm guessing that question is from you. Okay. So another question for Dr. Azima. Domiciliary care is offered by Hospice Malaysia has been excellent, very useful in supporting my elderly mother's healthcare needs at home since she was discharged from hospital. However, since Hospice Malaysia is a KL-based non-profit, their number of nurses are limited. Service is not widely available to our aging country. Can you please weigh in on this? Do you know anything about Hospice Malaysia?
Yes, I'm quite familiar with some of the board members of Hospice Malaysia. They are hospital based, and I think they're starting to move out of the hospital and into the homes. Unfortunately, it's a volunteer organization, so they depend a lot on contributions. So their budget is very limited. So, but the model is good. So I think the authorities, whether KKM or should look into it and maybe use them to train people in the public to do those kind of services like what I'm doing. I would love to partner with them, and also Jaya here does the thing when some of the non-medical people do the core course for CAPC and they're certified. I would have to send them over to you and to you too, in terms of getting the clinical hands-on experience. The important thing is people have to be trained to do it right. And Hospice Malaysia does not have the staff to meet the demand. We are not creating a demand. The demand is there. We're trying to meet the demand, and that's where the gap is. The gap is 180,000 people get discharged without the help of how to care for them at home. Someone has stroke, they're discharged. What do we do? How many times do you turn the person so they don't have skin breakdown? No, and someone is discharged with dementia. And then the grandchildren are complaining, why did this grandma asking me the same question 6 times? You have to remember, for dementia, the memory for recent event is lost. That's why they ask you 6 times for something you just told them. They can't remember. But the memory for distant event is still intact. So if you sing a pre-Ramli song, they can sing along. They remember all the words. So the caregiver has to be taught on how to respond to them. So part of this program is doing that, what I'm bringing over. It's more about caring for the caregiver so that they know how to care for the patient. It's more for the caregivers.
Okay, that's great. So is there support groups available within Klang Valley for caregivers to connect? Maybe the panelists can share some info. I think this one is to do with connecting with Dr. Saz and Izzati. I think they are already managing sort of their, and Orissa as well, managing their own communities, and these are part of the networks that we are doing. Sure, yeah.
My name is Jaya. I'm the co-founder of Aged Care Syndrome Heart and also Legend Care Center in PJ now. My background is actually nursing personnel. I've been in the nursing industry for last 30 years. I'm very fortunate, and also today I'm very happy to attend our core job, because our core job is taking care of elderly, and to be with Dr. Azima and all the speakers today, and I'm very happy. Just some thoughts that I want to share here. Basically, most of our service provider and also business, those who are doing the business in the elderly care, our issue and challenges is tremendous. Basically, on the licensing matter, I think 70% of our nursing homes or elderly home in Malaysia are unlicensed. Yeah, unlicensed. So even I myself, I'm having this issue here because my care setting is on a high-end setting. So I'm finding difficult with the town council regarding the licensing matter, because the community around there, they are not in favor to, they are not agreed to the care setting. They said nursing home is not, it's not appropriate to be in that area. So I find that the community support and also their awareness about how important of these elders who have been with us, whoever you are, every one of us will get to that stage one day. And in fact, I find that it's very, very disappointing feeling that I have. Most of that areas is actually well-educated people, but they have this kind of mindset not to support the elderly, the service as well, whatever. So I feel like educating the community today is number one core job for us to settle all the issues, because they are not, there are some group of people, they are not happy with this. So for me as today we are talking about this geriatric area, which is very, very important. And I feel like educating and provide the proper awareness to the public that is our core job, number one. Otherwise, whatever we are doing in this platform, it won't be able to reach to the goal, to the common goal. Number two is we do not have a proper school of caregiving in Malaysia, because everybody today are doing this caregiver training. There is no body to regulate, to monitor what the trainers are doing. Because I'm from nursing background, I have done my teaching a diploma, degree program in many universities, and also been as a principal in the nursing faculty before. And I find that they are doing caregiver training, but we don't know what is the content that's supposed to teach. What are the syllabus? What are the content that require in a geriatric care? Who is monitoring this? Is there anybody to regulate this, to see, like what Dr. Azima said that about palliative care? Actually, palliative care in nursing module memang we teach. Memang we have. But that is particularly for nurses who are working in the hospital. But how about in caregiving, carers, what they should learn? What they should learn, caregivers, what are the areas that should be touched? So this is certain things that we need to check and balance, because I see in more caregiving carers, because we are also supplying caregivers outside there. I'm also providing caregiver training and all that. But when they come and share with us certain things, it's unbelievable. They are doing wrong things to the elderly, which can affect the life of the elders. You know, so I feel like there are many things that we got to straighten here. We all of you here are coming and sharing the responsibility and knowledge, and we have to educate the public more. Yeah, thank you very much.
Okay, we'll take one more question from the floor. There will be opportunities to ask more questions to the panelists. There's food, refreshment. You guys can catch them after this. So we'll take one more question, yeah, and then you're free to network. Okay? So one more question.
Hi, my name is Ethan. I'm a counselor with special interest in preventive care and bereavement, actually. So I didn't ask auntie or sister question. I just happened to hear of it quite a lot. My question is actually with regards to the development of this industry. So after a while, there will be many elder care facilities, there will be many supportive services, and we'll get to a point where there's going to be competition for awareness, competition for resources, competition for human capital to provide the care. What are your thoughts on how can we plan more integrated services? Because I wonder after a while, there's going to be many social enterprises planning to target the same area. So how can we plan for integration even as we begin?
Always the lecturer can I do questions for the lecturer.
Okay, thank you very much. At the moment, it's still not enough. I mean, that's why I mean, if you want to start, just go ahead because we just don't have enough. And that's why we have friends, we are not competitors. And we always say, we should get together and we should collaborate. And actually, I start discussing with Izati regarding collaborations and so on because we just don't have enough hands to actually fulfill the needs of the community at the moment. The more is better, but of course, you mentioned about in future when everybody is doing it. Just let me just share about my story because we got into this by accident, not because we want to do it, actually, because the community where we stay actually needs the service. And there's a point where we feel like it's time probably we should stop, especially during COVID. We said because it's tough. It's tough, and to actually go on is very difficult. So I think that supporting the people who are actually giving up the service is very important. And I keep on wondering when the government is going to do something about it. Because sometimes to a point that it's burnout, like until when do we continue with this when the community needs it and we are actually to the point that I don't know when we're going to continue with this sometimes, yeah.
Even we are at a point that we have to reject customers now. So please, everyone, do this together. We need this everywhere. Actually, when I explain my service to others, people actually feel people are already doing it in other states. There's a group of nurses doing it in Surya Petani, in Taiping and things like that. But the only thing that is not integrated, right? So we are working into that. We are looking into that maybe do like a franchise model or where whenever you need a service, yes, we can provide it to you. It's like teman certified kind of service, like Makcik Travels approved kind of service. So we are looking into that because as much as we are doing it as a business, this is something that is very much needed for the community. So as long as people are doing this to help the community, we are all for it.
Everybody sometimes they want to do by themselves and they're so scared like to get together and and you might just treat my idea here and there. But I think at the end of the day, right, like what Dr. Shah said, there's not enough in the market. I mean, if you look at it, if you talk about hospital companionship. I think I would say that the three of us are one of the first few ones in business-wise to be running it as a business. There's many individuals who do it in their own state or even in Klang Valley. If you go to any women's group, there will be somebody who say that I'm doing it for that. But the thing is that, right, how do we standardize it? Of course, it's very hard. And not everyone's going to have the same mindset to come together and to be into one group and say that the one-stop solution for every one of it. And it'd be great actually if there are many different types of industry where they can support our senior community. You know, whether it's physiotherapists, whether it's doctors, geriatricians, clinics, and everything, and even food, right? My clients always ask us about food and ask us about equipment and everything. So if we make it into one group, like a one-stop solution, we need the right type of people with the right who understands the vision of the whole thing. Like-mindedness, that's the word I was trying to find. Yeah, like-mindedness, type of people to come together and work it and see how. I think it's on the end of the day, it's about. I think that's what Jia said. It's all about the community and to educate us. I'm all about educating community, and really community should be the number one thing when it comes to senior care. Because the more you know, the better it is you're educated. You know how to not only deal with your own senior, but the people around. Okay, for example, my daycare in SS Street, the whole row is all senior citizens. I can count how many widows are there. But yeah, I will share a lot of things, but also it all depends is our community. Sorry, boomers don't hate me for this, but boomers have a different mindset. It's all about face value. That's what I realize. You know, I've opened up to say that no, if you feel lonely, come just be with us. During 3 o'clock for tea break or lunchtime. Nobody comes. Only one neighbor next door will come for my parties and everything. No, but right, but you see, it takes a lot of effort. So I think every one of us have to play a role and advocate. You know, we talk about influencer. I think we should be the influencers in things like because that's where the word goes in. Yeah, I always believe that be an influencer that makes a positive change to your community. I think that's so important. So it's not only just for your friends and family, but it's also for yourself because we are getting there, right? I'm in my 50s. Well, we're not sure what's going to happen in the next few weeks, months, right? If I fall sick, and it's very important, always talk to your family. I've got 4 kids and we speak to our children all the time about growing old. We don't expect it from our children to take care of us, so we tell them what's our plan. So if either one is around, this is what we do. If 2 is around, this is what we do. You know, so talk to them. It's nothing. There's no taboo about it. Yeah, and I would say, do planning. Your funeral, everything. Trust me, I'll just share with them about what I went through during COVID. When my clients couldn't come back from overseas, we have to handle their funeral. We have to handle police report. We have to sign off bodies. It was a very emotional thing for us. So where do caregivers go in for support, right? So who do we talk to each other? That's where we need that peer support. I think that's very important. Yeah.
Thank you so much. Thank you, Oretta, Izzati, Dr. Saz, and Dr. Azima for participating in such a insightful panel discussion. Speaking of socials and influencers, they have social media, strong presence. Now we're getting Dr. Azima to join us on social media as well, since she's going to be working with us a lot, so that we can make TikToks together. Okay, so thank you so much for being here, right? As you've all heard repeatedly throughout this panel, aging journey is a shared one. It takes us men, women, families, businesses, civil society, and communities to make aging safe, active, and meaningful. We hope today's section has been sparking ideas, partnerships, and action beyond this room. I just want to share one little thing. If you are an SE, right? If you are a social enterprise, please scan this QR code and find out more about Hasanah Social Enterprise Fund. Yeah, we just launched our 2025 fund, so exciting times ahead. So thank you so much, and we'll see you at the next one. Back to you, Tasha.